Bon après-midi à tous et à toutes. Nous sommes ici aujourd'hui, surtout par téléconférence, avec la ministre Jordan, ministre des Pêches et Océans, le ministre Wilkinson, ministre de l'Environnement, et Tom Wong, médecin en chef de Services aux Autochtones Canada. L'ordre de parole sera le suivant. D'abord, la ministre Jordan, suivie par le ministre Wilkinson. Ensuite, Tom Wong et pour clôturer moi-même. Donc, sans plus tarder, la ministre Jordan. Bernadette? Minister Jordan? Okay. Let's go straight to Minister Wilkinson, and we'll go back to Bernadette. Minister Wilkinson.
All right. Thank you, Marc. Bonjour, hello. The Prime Minister announced this morning that of services at several national parks, national historic sites, marine conservation areas, and wildlife areas on June the 1st. The limited openings will align with guidance provided by respective provincial health authorities. It will not apply to all parks, so it will be important to check for the status of your local park. Ces ouvertures viseront à permettre à la population locale d'utiliser et de profiter des parcs près de chez eux. Avec le printemps qui arrive, il est important que les Canadiens disposent d'espaces dans lesquels ils peuvent faire de l'exercice et découvrir la nature d'une manière qui soit conforme à l'exigence d'éloignement physique. We all know how important it is to get outside and to be in nature. It is good for our mental and for our physical health. This partial reopening will allow visitors to have access to trails, grounds, day use areas, and green spaces where physical distancing is possible. Limited facilities such as washrooms and comfort stations will also be made available to visitors. I would emphasize that services will be very limited to begin with. As we move forward, we would hope to expand the range of available services, but this must be done in a thoughtful and a prudent manner, one that is consistent with putting priority on the safety of Canadians and, of course, on our Parks Canada staff. We must enjoy these places safely and follow the advice and guidance of public health experts. People should check ahead on the websites to plan their visit and prepare appropriately. Certainly follow us on social media for just-in-time updates. Thank you very much. Merci.
Okay, we'll go back to Minister Jordan and see if everything's working. Bernadette? Over to you, Minister Jordan.
Well, thank you. Good afternoon. Hello, bonjour, kwai. The women and men who work in Canada's fish and seafood sector are the economic drivers of many of our coastal, Indigenous, and rural communities. They've been feeding Canadians for generations, and we need them to be able to continue to do so safely in these very challenging times. While hardship and uncertainty is felt across the country, the fishing sector faces challenges that are unique, and they require direct solutions. That's why today, our government is announcing $469 million in funding to establish the new Fish Harvester Benefit and the Fish Harvester Grant. This is the single largest investment to Canada's fisheries in nearly 20 years, ensuring that Canada's hardworking independent fish harvesters get the support they need now and while positioning the sector for a strong recovery. The new Fish Harvesters Benefit will provide up to $267 million income support for eligible self-employed fish harvesters and chairperson's crew who cannot access the Canada Emergency Wage Subsidy. Support will be provided to those who experience losses of 25% or more during the 2020 tax year, up to a maximum individual equivalent of $847 per week for up to 12 weeks. The new Fish Harvester Grant has dedicated funding for up to $201 million in non-repayable support to licensed self-employed fish harvesters who cannot access the Canada Emergency Business Account. They can use these funds to cover the costs of running their fishing businesses, including increases in costs due to the health and safety requirements. Lastly, we will also EI rules so that fish harvesters can apply for EI benefits based on earnings from last year. We'll support you now and into the future. We continue to assess and respond to the impacts of COVID-19 and take additional actions as needed to support Canadians, stabilize the economy, and mitigate the impacts of this pandemic. Canadian harvesters are resilient and determined, and today I am urging Canadians to show their support by purchasing more of our high-quality, sustainably sourced products at your local grocer. There's never been a better time to buy a Canadian fish and seafood product. Our harvesters, many of who will be heading out for their spring season tomorrow, can continue their vital work knowing that the Government of Canada is here to support them every step of the way. Thank you. Merci. Walalan.
Merci, Madame la Ministre. Tom, Chief Medical Officer, Indigenous Services Canada.
I want to acknowledge that we are on the traditional territory of the Algonquin people. As of May 13th, a total of 185 cases have been reported among First Nations living on reserve in provinces. This represents less than 0.3% of reported Canadian cases, whereas First Nations on reserve in Canada constitutes about 1.5% of the Canadian population. Of the 185 cases, 63% have recovered. 18 cases, that is 10%, required hospitalizations. And there have been 2 deaths on reserve. The First Nations on reserve case fatality rate is currently at 1% and is below the Canadian overall case fatality rate of 7%. We are cautiously optimistic that nationally, the First Nations on reserve curve continues to show signs of flattening if there's no future spread of COVID in First Nations communities. This has been accomplished by impressive First Nations leadership and decisive actions in using public health measures, including lockdown, physical distancing, prompt isolation, avoiding crowds, hand and cough hygiene, and it has paid off. Beyond infections in First Nations living on reserve, there are many more cases elsewhere in Canada involving First Nations, Métis, and Inuit, with COVID-19 being reported to the provinces and territories. Timely epidemiological data collected by Indigenous Services Canada is only available for First Nations living on reserve. We need help from provincial and territorial health departments and agencies to support Indigenous peoples to get a comprehensive epidemiological picture beyond First Nations on reserve. As different jurisdictions are entering into the early stage of reopening of the economy, it is important to recognize the inherent rights and self-determination of First Nations, Inuit, and Métis people. Communities will decide what is best for them in the unique context of remoteness, access to health services, living conditions, and the prevalence of underlying medical conditions. Les communautés décideront de ce qui leur convient le mieux, dans le contexte unique de l'éloignement, de l'accès aux services de santé, des conditions de vie et de la prévalence des conditions médicales. Cependant, nous devons être extrêmement vigilants pendant la réouverture progressive de l'économie pour empêcher l'introduction de ce virus dans les communautés autochtones. Miigwech, Nakumek, merci, merci, and thank you.
Thank you, Tom. As today is Indigenous Nurses Day, I would like to begin by saying thank you, merci, miigwech, marcy, nakumik, hi nyawan, Wilalin, Haishka, Marcy Cho, to all First Nations, Inuit, and Métis nurses for their incredible work caring for patients and providing culturally safe healthcare during the COVID-19 pandemic. As we are learning from past experiences responding to pandemics in Canada, and specifically in First Nations, Inuit, and Métis communities during the H1N1 virus, we need to recognize and understand that they have a higher risk of being disproportionately affected by COVID-19. The First Nations and Inuit Health Branch continues to provide effective, sustainable, and culturally appropriate health programs and services that contribute to the reduction of gaps in health status between First Nations and Inuit and other Canadians. And I would like to remind everyone that improving the health of Indigenous people in Canada is a shared responsibility between federal, provincial, territorial, and Indigenous partners. Our goal continues to be to work with all in partnership to ensure Indigenous communities receive the care they need. By working together, we're saving lives. As Tom mentioned, as of May 13th, we've seen 185 confirmed cases of COVID-19 in First Nations community, 16 cases in Nunavik in northern Quebec, and 117 representing the proportion that the Chief Medical Officer stated are considered recovered. We've also been closely monitoring the situation in northwestern Saskatchewan, and to support communities in response to the outbreak, we will be providing $2.3 million in funding, which will go towards the Northwest Saskatchewan Pandemic Response Plan. This pandemic plan is a collective effort between First Nations, Métis, municipal, provincial, and federal partners. Meadow Lake Tribal Council and Métis Nation Saskatchewan have undertaken exemplary collaboration in leading the response to this significant outbreak. The funds will be jointly administered and will complement the ongoing community-based efforts to conquer COVID in the region and support security checkpoints and impacted community measures to address food security, provision of home care supplies, and enhancement of regional and community capacity, which includes youth engagement. We will continue to work with the Northwest Communities Incident Command Centre, including provincial health authorities, First Nation and Métis communities in the area to support their efforts through increased access to testing, enhanced surveillance, strong contact tracing, and infection prevention and control measures. We're focused on the health response that will save lives, and I want to reassure Indigenous leadership that we are committed to supporting Indigenous communities and activating their pandemic plans and providing the support in collaboration with provinces and territories that best respond to each community's needs in response to the COVID-19 pandemic. I would also like to give a quick update on Szechuan First Nation. The Ontario Ministry of Natural Resources and Forestry has advised us that risk of flooding has been downgraded to moderate to low along the Albany River, and this is good news. While the downgrade is encouraging, we stand ready to activate contingency plans if needed. Repatriation of Szechuan residents who are on the land began yesterday, for which we have supported air transportation back to the community to ensure the health and safety of all members. We will continue to work in close coordination with community leadership, the province, Muskegowik Council, and other federal departments to address concerns related to flooding and plans for evacuation in the area. Lorsqu'il s'agit de combattre la propagation de virus, les communautés urbaines et hors réserve des Premières Nations, des Inuits et des Métis sont confrontées à des enjeux uniques. Depuis le début de la pandémie, les organisations autochtones urbaines et hors réserve, ainsi que les organisations communautaires locales, travaillent 24 heures sur 24 pour fournir des services directs aux peuples autochtones. Nous reconnaissons que la COVID-19 a mis une pression supplémentaire sur les opérations et a augmenté les dépenses globales de ces organisations. En réponse à ces besoins, nous avons pris des mesures immédiates pour soutenir ces organisations par le Fonds de soutien aux communautés autochtones, où 15 millions de dollars ont été attribués aux organisations autochtones régionales, urbaines et hors réserve. Ces organisations peuvent également recevoir des fonds d'autres initiatives fédérales dans le cadre du plan d'intervention économique, comme par exemple l'initiative Vers un chez-soi d'emploi et développement social Canada et le financement supplémentaire attribué aux refuges pour femmes qui fuient la violence et les centres d'aide aux victimes d'agressions sexuelles. Des fonds supplémentaires pour les banques alimentaires ont également été mis à la disposition afin de répondre aux besoins alimentaires urgents des Canadiens, y compris les peuples autochtones et les populations du Nord. En plus du financement fédéral, les provinces et les territoires ainsi que les individus, par le biais des dons de charité, jouent un rôle clé dans le soutien de ces organisations. Nous reconnaissons toutefois qu'un plus grand soutien est nécessaire. Nous travaillons activement avec les communautés pour identifier les supports, les besoins dont elles demandent et nous collaborons avec d'autres partenaires gouvernementaux pour explorer d'autres possibilités d'aider davantage d'organisations autochtones, urbaines et hors réserve. I would also like to acknowledge that summer is fast approaching, a time of year that is usually marked by sacred ceremonies and events that are very important to Indigenous peoples across the country. While banning sun dances, potlatches, among other Indigenous cultural and spiritual practices is unfortunately a dark stain on Canada's history, I want to ensure everyone listening that even in the face of a historic pandemic, Canada must not and will not prohibit these important practices. Any decision to cancel or postpone these events is a decision that is solely at the discretion of the community's leadership. I would, however, like to reiterate the importance of the public health measures that we have been repeating since the beginning of this pandemic. Together, we can slow the spread of COVID-19 by making a conscious effort to keep a physical distance between each other, avoiding crowded spaces and contact with people at higher risk, such as elders. First Nations leadership will ultimately decide how to proceed safely in this context, and I would like to encourage leaders to develop guidelines in alignment with the best available public health practice to adapt these ceremonies. In closing, Tuesday marked 150 years since Manitoba joined Confederation under the leadership of Louis Riel and the Métis people. For thousands of years, Manitoba has been home to a number of distinct Indigenous communities, such as the Assiniboine Cree, Ojibwe, Dakota, Dene, and Inuit. The Métis Nation would also form its own distinct culture that would further shape Manitoba's identity and play a pivotal role in establishing Manitoba as part of Confederation. This is an opportunity for Manitobans and all Canadians to reflect on the past and present and to look forward to the bright future of the province. Part of our present and future is walking the path of reconciliation with Indigenous peoples. We must also acknowledge past wrongs and chart a new path forward based on the affirmation of rights, respect, cooperation, and partnership. While COVID-19 is impacting the celebrations that are fitting for such a significant anniversary, we encourage Canadians from coast to coast to coast to learn more about Manitoba's history and culture and to participate in the many virtual Manitoba 150 celebrations and activities being offered online. Miigwech, Nakumik, Marcy, thank you. Merci à tous.
On est maintenant prêt à prendre les questions. Thank you, Minister. We'll start on the phone with 3 questions, then turn to the room. 1 question, 1 follow-up. Opérateur.
Thank you. Merci. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question, faites étoile 1 sur votre téléphone à clavier. The first question is Brett Forrester from APTN National News. Please go ahead. The line is now open.
Hello, everyone. Minister Miller, on May 9th, you encouraged vigilance, saying remoteness may have delayed the onset of COVID-19 in First Nations, Inuit, and Métis communities. How concerned should we be about a second wave as provinces begin to loosen up restrictions?
We should be very concerned, Brett. As we know, until such time as a vaccine is found and distributed and administered, the risk of second and third waves is very real. And while remoteness has sheltered a number of communities, thanks most importantly to the leadership that medical staff in the community, medical leadership, health officers, and political leadership have ensured, we need to remain vigilant. And the challenge that we all face as a society, as restrictions are lifted, it is very difficult from a political perspective to ask Indigenous peoples to do something that we ourselves would not be prepared to do. And that reflection is very important as we look at the various measures that need to be taken and supporting individual leadership in taking the decisions that are proper to them and that they see are the most important to their communities. And so with that is required a constant dialogue, constant vigilance, and interaction with Indigenous Services Canada, provincial authorities, to make sure that the best medical recommendations are being followed in the community. That will pose with it, as you will recognize, Brett, a number of challenges, whether it is people seeking to come in and out of communities and observing restrictions that aren't necessarily observed in urban settings. And I think that's something that we will be turning our minds to and have started to turn our minds to as we attempt to provide additional supports, air continuity, food security, all supports that Indigenous communities need to weather this global pandemic.
Brett, follow up?
Yep, thank you. We heard at committee that urban Indigenous people often deal with a number of risk factors. Some of them are the same as folks on reserve, such as overcrowding and underlying conditions, among others. What is your message to First Nations, Inuit, and Métis people who live in cities and maybe feeling ignored or a bit left behind right now?
Well, as we've traced the chart of this or the course of this epidemic, Brett, some things are becoming very obvious. One, that this epidemic hits the most vulnerable, particularly those living in crowding conditions, particularly an older segment of the population, and we are learning from this. We know the social determinants of health that have rendered Indigenous communities on a less equal footing than non-Indigenous communities, and that isn't restricted to on reserve. Indeed, in certain urban settings, there are populations that you could say are even more vulnerable. We have deployed, as I mentioned in my speech, $15 million to support, among other things, 94 organizations, the National Friendship Center. We've acknowledged that is absolutely not sufficient. We are working hard to provide additional supports. There are other programs that have been deployed. Minister Monsef, among others, has dedicated a number of financial resources to supporting women's shelters, in particular to support those in need, about $40 million, $10 million of which was dedicated, I would note, to Indigenous shelters on reserve. There are a number of other initiatives. The Vers un chez soi, I'm at a loss to translate it in my mind at this point, but also supports for homeless initiatives that have been announced by the Prime Minister, as well as food security initiatives. All this to say, Brett, is that we absolutely acknowledge that this is not enough. There is no way to pinpoint exactly what the outcome of this epidemic will be. And so we stand ready to support, and we will act proactively to support those communities that are best in needs, and the service providers who do a great job with very little resources to support those communities in need.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. La prochaine question, Philippe Vincent Foisy de Radio-Canada. Votre ligne est ouverte.
Oui, bonjour, Monsieur Miller. J'ai une première question pour vous. La semaine dernière, vous avez dit que vous étiez inquiet de la ouverture possible à Montréal. Vous avez inquiété qu'il y ait plus de morts, qu'il y ait une deuxième vague. Or, là, on apprend que les écoles de la CMM vont rester fermées jusqu'en septembre. Les services de garde sont fermés au moins jusqu'au 1er juin. Et il n'y a toujours pas de décision qui est prise pour l'ouverture ou non des commerces à Montréal. Est-ce que ce recul-là du gouvernement québécois vous rassure?
Merci, Philippe Vincent. Écoutez, depuis le début, que ce soit le premier ministre du Québec ou que ce soit notre premier ministre, se sont fondés sur les données probantes de la science pour prendre des décisions politiques, des positions politiques parfois très difficiles en temps réel. Nous reconnaissons, évidemment, tout le monde reconnaît ce qui se passe à Montréal et la peur que j'ai exprimée envers le taux croissant de gens qui meurent dans des conditions exécrables est un constat qui perdure et on est loin d'être sorti du bois. Alors, évidemment, je salue l'initiative du gouvernement Legault d'avoir mis à plus tard cette ouverture. Évidemment, on regarde toujours cette fameuse courbe épidémique pour pouvoir prendre des décisions qui pourraient avoir des impacts dans plusieurs semaines. Et évidemment, vu que c'est un virus, les décisions qu'on prend aujourd'hui ont des répercussions qui ne sont pas nécessairement perçues demain. C'est dans une semaine qu'ils sont perçues. Alors, s'il y a des ratés, ce n'est pas une question de blâmer qui que ce soit, c'est une question de reconnaître que nous prenons tous des décisions en temps réel et s'il y a lieu de rectifier le tir, de le faire selon les données les plus prévalentes de la science. Et évidemment, je salue cette initiative. Je salue d'autant plus le travail que font nos forces armées canadiennes à aider les gens qui sont dans un état très, très, très vulnérable. Et ce travail continue et continuera jusqu'à temps où les gens sont en santé et hors de danger. Alors, j'espère que ça répond à ta question, Philippe Vincent.
M. Foisy, en suivi?
Oui, une autre préoccupation, surtout des gens d'affaires, là, vous devez en entendre quand même beaucoup. Là, il y a beaucoup de gens d'affaires dans votre circonscription à Montréal, notamment, qui disent la prestation canadienne d'urgence fait en sorte qu'il y en a plusieurs qui ont de la difficulté à engager. Donc, la subvention salariale fonctionne pas nécessairement autant qu'ils l'auraient souhaité. Ma question, c'est est-ce que la prestation canadienne d'urgence, après les 4 mois, c'est terminé ou après les 4 mois, vous voulez la modifier pour qu'elle soit un peu plus souple et qu'elle encourage les gens à travailler. C'est juste ça que j'ai de la difficulté à comprendre. La PCU, c'est fini après ces 4 mois ou vous allez la modifier?
Bien, dans toute prise de décision qui se fait en temps réel avec des impacts économiques tels que vous l'avez décrite, c'est clair qu'il faut être en position de pouvoir rectifier le tir, de pouvoir prendre, de réajuster là où on voit des effets pervers se manifester. Je ne présumerais jamais qu'une personne qui a besoin de cette prestation refuserait de travailler. Pour autant, les gens veulent travailler. Et donc, vu que le soutien aux emplois a été annoncé il y a 2 semaines, il va falloir laisser ce soutien prendre son effet, le constater de façon économique, le tracer et puis de rectifier le tir s'il y a lieu. Alors, c'est à voir.
Merci, Monsieur le ministre. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. The next question is from Andrea Gunn from the Chronicle Herald. Please go ahead. Your line's now open.
Hi, Minister. My question is for Minister Jordan. I am wondering if there needs to be any legislation passed for these benefits for fishers, and if so, how long we can expect to wait, or how long they can expect to wait before they can start seeing money for certain things, such as the wage benefit. And I also have a follow-up question.
So there is, thanks, Andrea, for the question. There is no legislation that's required for this. We are working right now around the clock to make sure that we can get these benefits out as quickly as possible, because we know how important it is to make sure that Fisheries has the support that they need and that they've been very much looking for. So we're working really hard to make sure that we get that out as quickly as possible.
My second question is will it be available for, like, if somebody doesn't want to go fishing because they're too worried about being in close quarters, they don't have any trusted family members that they're fishing with that they're certain don't have COVID or aren't going to expose them to COVID, will they be available? Will they be eligible for this benefit?
So these benefits are threefold. First of all, to make sure that people who no longer qualify for Fisheries EI are able to use their income from last year in order to continue their EI, as well as making sure that they're able to access the wage subsidy equivalent that they do not qualify because of the unique nature of their business. And then, of course, having the grant in order to make sure that they can meet the needs that they have immediately to address concerns that they have. It's a $10,000 grant. These are all things we're working on and making sure that people have the supports that they need to go fishing, to make sure for the long term that they're able to collect their EI. It's been something that we heard a lot about from fishers for the last couple of months, and that's why we're making sure that we have those supports in place for them.
Thank you, Minister. We'll now turn to the room, starting with Mr. Gallagher.
Kevin Gallagher with CTV News. My question is for Minister Miller. You've already commented on that $15 million for off-reserve Inuit First Nations Métis is inadequate, but I'd also like you to comment on the judicial review filed by the Congress for Aboriginal Peoples with the Federal Court of Canada, saying the funding is inadequate and discriminatory for that same group of people.
Thanks, Kevin. It's an important question. I would like to preface my answer by saying I'm in no position to dictate to any organization how to exercise their legal rights. And so that is absolutely their right, and I respect it. We have moved from the very beginning to distribute money in the urban context to service providers that are on the front lines, and we haven't funded per se any national organization as such. And so the question in determining the funding was really to get it out to the people that needed the most at that point in time, knowing that there was a $15 million bucket that Indigenous Services Canada administers. And given that, I would say that CAP did receive an amount of $250,000, and my understanding from committee yesterday that was their intention to return the funds. But that said, I don't have any particular comment on the way they exercise their rights, and indeed that is it is their right to do so.
Can you give me an understanding of the ventilator capacity of First Nations? What is the strategy if there is an increase in cases and hospitalizations that would require that type of medical intervention? It's a major concern in big urban centers, but I imagine that ventilators are very difficult to come by in isolated First Nations.
Thank you for the question. One of the key things that for us, it is so important to make sure that we protect the most vulnerable. The way to approach, the ventilation needs has to be a well thought out planned process. For example, it is very unsafe to have ventilators in nursing stations or in remote areas. Why? Because you need specialists. You need intensive care trained specialists in medicine and in nursing. You need respiratory therapists. Those are all specialists, and they are very hard, to come by, to actually be in remote and isolated areas. Even in urban or semi-urban areas, there's a shortage of those specialists. So therefore, the way to approach this is to ensure that we work with provinces and territories to increase the capacity of existing hospitals so that they have more beds, they have more ICU beds, in case that there's a need, to actually use those beds. Also, from a prevention standpoint, in addition to all the public health measures that we've been talking about, also the need to try to identify for high-risk individuals, such as elderly, for example, have a very low threshold to make sure that should they become sick, it would be at the very, very early stage to actually try to actually support them to actually move to a center where it's closer to the hospital should they need that type of tertiary care. Thank you. Yeah.
Is the strategy, though, I'm sorry, is there a strategy it sounds to me that people who are on a remote First Nation that might need that type of medical intervention, a ventilator, they would have to be transported then to a major center. Is that right? So, now, maybe the major center is probably overstating it, but a hospital that is equipped, right?
That is correct. Yes.
So, is that already planned? What's the plan for that? Is that already budgeted for? How would that transportation work? But I'm just wondering if you could answer that.
Yeah, that's already been planned for in collaboration with provinces and territories in the provincial healthcare system.
I think there's a general question I think you're asking about the implementation of a pandemic plan for communities that are more remote or difficult to access. There's about 96 First Nation communities that you can only fly into and 50 Inuit. That's part of a generalized approach when it comes to healthcare generally. There are some communities where it's more advisable to fly out to give birth, for example, or transport out of the community. When you look at the implementation of a pandemic and the plans that are attached to it, the communities have, depending on the capacity, demographics, the number of medical personnel in the community, there's been a concerted approach to figure out when it makes more sense to fly someone out for medical interventions, including use of ventilators. Tom has explained the intricacies around having the personnel that are trained to be able to use those devices, but it's part of a more general discussion and comment. We have a technical briefing actually this afternoon that you're more than welcome to participate to that can go into a little more detail about that, because it's part of a more generalized plan of using hubs and getting people out of those communities as quickly as possible through medevacs and back into more regional health centers where we can have those facilities and the properly trained people to use them, and then get people back into community in a safe way. So I'd encourage you, Kevin, to participate that if you could.
Thank you, Minister. Just a reminder that you have colleagues waiting on the phone. One question, one follow-up. Sean?
Hello, Sean Kilpatrick from the Canadian Press. My question is for Minister Wilkinson. Most Canadians do not live close enough to national parks and historic sites to be able to visit them without driving far away from their homes. Are you saying that traveling to these places is now okay?
No, that's certainly not what we're saying. What we are saying is that there are many parks that are proximate to places where folks live that traditionally have been places where people go to be able to experience nature, but also just to be out and about. and in this context, being able to do so while they physically distance. So the direction here is we are beginning a very gradual reopening of parks, but the message is you go to the parks that are nearby you. There are many, including Rouge National Park and Bruce and Banff and Jasper and a range of those. Go to the parks that are nearby you and experience that. Use that as part of an appropriate way to think about creating more space for people as we move towards spring and summer to be able to physically distance. But we are not encouraging travel beyond the local area, no.
No follow-up. Thank you.
Okay. Thank you, Minister. We'll go back to the phone. Operator.
Thank you. Merci. La prochaine question est de Mélanie Marquis de La Presse. Votre ligne est ouverte.
Oui, bonjour, merci. Ma question est pour Monsieur Miller. Monsieur Miller, depuis le début de la pandémie, il semble assez clair que les tensions demeurent avec certains groupes autochtones, notamment les Wet'suwet'en, où on a un mécontentement de la part des chefs élus qui réclament la démission de Mme Bennett, des chefs héréditaires qui, eux, sont mécontents d'avoir vu une agence fédérale octroyer une aide, un prêt au promoteur du Coastal GasLink, le gazoduc. Pourriez-vous dire où on en est en matière de réconciliation avec les peuples autochtones? Est-ce que ce grand projet a été vraiment mis en veilleuse en raison de l'ampleur de la crise de la COVID-19?
Merci, Mélanie. Et je pense qu'il faut se souvenir qu'avant cette pandémie, cette crise, il y avait la crise des barricades sur les voies ferroviaires en lien avec le mouvement de solidarité pour le peuple Wet'suwet'en. Et donc, et tous les constats que vous avez faits en ce que les gens peuvent conclure sur l'état de la réconciliation. La chose, et je vis ces clivages à chaque jour avec mon équipe, d'autant plus que Mme Bennett les vit aussi, c'est que la réconciliation en soi n'est pas forcément linéaire ni facile. Et ce qu'on a pu tisser comme conclusion à la suite des barricades, c'est l'important, c'est de se parler puis d'avoir un dialogue. Et c'est à travers ce dialogue qu'il peut y avoir des percées, évidemment pour éviter des conflits qui peuvent être de nature armée, comme on a pu le vivre par le passé. Puis l'important dans tout ça, c'était d'apprendre de nos erreurs, des erreurs grotesques qui entachent notre histoire. Et je réfléchis à tout cela et je me dis comment est-ce qu'on a pu s'en sortir, et c'était à travers un dialogue, une ouverture envers des personnes avec lesquelles on n'a pas l'habitude de dialoguer, c'est-à-dire des gens qui manifestent sur les rails, des gens qui, à l'envers et contre tous, nous opposent de façon constante et parfois pour cause. Je réfléchis aujourd'hui, et c'est une journée historique, il y a 23 ans, la Cour suprême du Canada, dans l'arrêt d'Elgamook, a statué que les chefs héréditaires avaient un droit légal, un droit qui ne s'est pas cristallisé avant 2 décennies par la suite, même plus tard, parce qu'on n'est pas sorti du bois non plus. Le protocole d'entente qui se signe aujourd'hui trace une piste de solution pour pouvoir en venir à cette reconnaissance de droit. Elle n'affecte en rien le droit des conseils de bande élus. Mais c'est clair que ça leur met dans une position difficile. Ça met tout le monde dans une position difficile parce qu'ils doivent maintenant entamer un processus de conciliation, de gouvernance qui n'a pas été fait depuis fort longtemps. Et donc, oui, il va y avoir des discussions difficiles, discussions surtout et avant tout qui doivent se faire par le peuple Wet'suwet'en, que ce soit les conseils de bande ou les chefs héréditaires. Il y a des structures qui ne sont pas parfaites, qui n'ont jamais été parfaites, mais ils doivent maintenant concilier avec ce fait et aller de l'avant avec un protocole d'entente qui, lui non plus, n'est pas parfait. Mais c'est quand même une journée historique aujourd'hui où Mme Bennett et le ministre Fraser de la Colombie-Britannique vont signer un protocole d'entente qui se fait attendre depuis l'arrêt d'Elgamook dans les années 1990-13, donc il y a 23 ans.
Mélanie, en suivi?
Oui, mais toujours là-dessus, Monsieur Miller, comprenez-vous que l'octroi d'un prêt, je comprends que c'est via une agence fédérale, la Banque de développement, mais comprenez-vous néanmoins que ce prêt-là arrive comme une frustration, vienne jeter de l'huile sur le feu, sur un feu qui s'était jamais vraiment éteint, là, qui était en veilleuse en raison de la pandémie?
Ben, je vous dirais que ces points de vue existaient bien avant la pandémie. Et l'octroi de prêt en tant que tel s'est fait, comme vous l'avez souligné, par une agence qui est indépendante.
Merci, Monsieur le ministre. Opérateur, prochaine question, s'il vous plaît.
Merci. Thank you. The next question is from Dylan Robertson from the Winnipeg Free Press. Please go ahead. Your line is now open.
Hi, Minister Miller. Manitoba Hydro plans to double staff at its kiosk mega project site. The Provincial Health Authority approved the plan before Hydro had consulted with the local First Nations. They're worried about an outbreak similar to what we've seen in Alberta and Saskatchewan. Is your government going to intervene?
Thank you, Dylan, and thank you for the question. As you know, this is a discussion between the Manitoba government and the First Nations in question. Clearly, the health and safety of First Nations is not lost on the government of Manitoba. To begin, and again, I would ask you to direct further inquiry to the government of Manitoba.
Dylan, follow up.
Good stuff. And a question for Minister Jordan. I wanted to know about inland fisheries. Many of the supports that have been rolled out don't apply to fishers in the prairies. And I'm also wondering what you're going to do about the Freshwater Fish Marketing Corp dealing with a glut of products and, not buying fish from fishers.
So thank you for the question. And the eligibility is going to be based on individual applications. With regards to the Freshwater Fish Marketing Corporation, that's a Crown corporation that makes its decisions independent of government. And, I recognize that they've got some challenges this year, but we're doing everything we can to support harvesters right across the country, as well as inland fishers as well.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. La prochaine question est de Catherine Lévesque de la Presse canadienne. La parole est à vous.
Oui, merci beaucoup. Ma première question est pour Monsieur Wilkinson. Je voulais juste vous entendre en français sur Parc Canada. En gros, si on comprend bien, les gens devraient visiter les parcs, mais juste à proximité de chez eux. Autrement dit, ce n'est pas un buffet ouvert là, pour quiconque veut aller visiter les parcs nationaux. Est-ce que je comprends bien?
Oui, c'est correct. C'est la prochaine étape pour nous de enlever quelques étapes pour avoir une situation dans laquelle les citoyens qui vivent près des parcs nationaux et les autres aires protégées peut avoir l'opportunité de marcher dans les parcs, d'avoir une place dans laquelle on peut avoir un éloignement physique. Mais nous avons dit que on a respecté les règles des provinces et on doit penser que tous les autres Canadiens, et maintenant, c'est pas le temps pour les gens de voyager très loin de leur maison. Aujourd'hui, c'est une prochaine étape, mais bien sûr, c'est premièrement pour les gens qui vivent près des parcs nationaux.
Catherine, en suivi?
Oui, merci beaucoup. And my next question is for Minister Jordan. Can you just explain in a nutshell the difference between the two major things that were announced today? So the benefit of $10,000, I understand that's going to be for self-employed fishers. And what's going to be the difference with the non-repayable grant of $10,000? Is that for those who own a business
only. So why the difference between the two, and how are we going to calculate the loss of revenue? Thank you.
Okay, thank you. So first of all, the fish harvesters benefit, because of the way that the fishing enterprises are structured very uniquely, they did not qualify for other programs that we've put in place. So what we're doing is making sure that they're getting the same type of benefit, although through a new program. So the wage subsidy, for example, what they will be able to qualify for under the fish harvester benefit would be equivalent to the wage subsidy. And what they're going to qualify for under the grant is a $10,000 non-repayable amount that they couldn't get because they did not qualify for the business account.
Thank you, Minister. And today's bonus question goes to Mike from Global.
Thank you, Mr. Miller. I spent some time in the Northwest Territories, so I understand the medical travel thing a bit. Has it changed anything really from what normal situations are? Have we added more money to it, or is it, if you're sick, we send you to Yellowknife, we get you out of your community, we send you there. If you're pregnant, we take you to Yellowknife. If you got COVID, we take you to Yellowknife. Is that the same procedure we've always had?
Well, maybe ask Tom to follow up on this because it's a very important question. I mean, obviously a global pandemic changes the risk profile you take in evacuating people, and even moreover bringing medical personnel into communities, and what elements you treat in community, what ones you postpone. So it has changed things, and it's put an immense pressure both on territories and on the airlines that serve them, as well as on how we profile the risk. And so whether it's decisions that need to be taken with respect to making sure that the personnel coming in and out, which is there to serve the people, don't spread something, which we're very, very conscious of, and we've done so with respect to flying First Nations with Indigenous Services Canada charters to make sure that we're transporting personnel and food, equipment in the safest way possible. But also the decisions that are taken by the territories. And as you know, the territories take the decisions with respect to the airlines. But we've provided them monetary support. We've provided them support in terms of how we co-pay with Nunavut in particular, and how FNIB fills the spaces that are necessary for those airlines. And obviously those airlines are seeing a drop in some of the travel that they would take. And it also influences the number of people or federal officials that we send up, and the people and transport getting community that are transported out of community for medical interventions. So the answer is yes, it has. We haven't fully appreciated the distortions that it's created. Obviously, it's created a need for more remote health guidance, telehealth, more nurses in community when we've seen potential cases break out, and the need to deploy rapidly on an emergency basis based on the unique risk faced by COVID. But I would say absolutely, yeah, it has created a number of considerations that we obviously no normal person could foresee, but it also has created the need to be ready with regional hubs to go in and out and have testing centers in different areas, as opposed to flying samples into Ontario or into the national lab in Winnipeg, having something in Iqaluit, for example, so that we can get those tests back quickly, because if you have a negative test, you want to be able to give that person reassurance that the test is negative and not have to ramp up your intervention. So it has in many ways. I think I could go on for a long time, but I'll pass it over to Tom, who actually has a medical degree.
Yes, indeed. We support the territories in their formulation of the plan and execution of the plan, and when it's needed, we offer additional support, such as recently, when there's a need, to have extra capacity for on-site rapid testing. We work with the territories to provide that. So likewise, for any other needs, including transportation, medevac, building on existing infrastructure, existing processes, we are there standing behind First Nations, Métis, and Inuit communities wherever they live across Canada, in order to support them, in order to protect the optimal protection for their security and for their health. Thank you.
Okay, thank you. And the next question I have is about healthcare staff. A lot of times there's locums, they go up for 2 weeks, they come back, they alternate, and we have a constant wheel of healthcare people coming in and out of these communities. Has that changed in any way? Have we put in different strategies to protect both healthcare workers and the communities?
I'll speak generally to it. I mean, we've examined a suite of options, including extending contracts, making sure that we have more robust health procedures and screening. The testing, as you know, point of sight is not at the point where we can actually get the type of result back where we could get within a very, very short period of time the assurance that the person going in is completely negative. But as we've said with all testing, it has to be surrounded by a suite of other tools that we examine and precautions we take with respect to screening. It makes screening much more important. The dedicated air service that we've done for First Nations flying communities, the supports we've provided to territories to surround personnel, and the surge capacity that we've provided. But I think I'd ask Dr. Wong to continue on that.
In the north, the reality is very different than in the south, and each community and each territory will make their own decisions, working with all the partners to see what is the best. And for some, it's making sure that folks, including healthcare workers or essential workers from the south, they self-isolate for 14 days before they actually, go to start working. For others, it's a modification, of that. And the bottom line is that communities want to make sure that the healthcare workers actually coming in, they don't bring the virus into the community. And each community works very differently in how they execute the plan.
Thank you, Doctor. Voici tout ce qui met fin à la conférence de presse pour aujourd'hui. Merci. Thank you.